Hi, I'm Holger. I'm going to show you how to take basic vital signs, which is very important, especially for those of you who are planning to go out in the wilderness. The important part of this aspect is knowing just how well your patient is dealing with the situation or how well they're not dealing with it. So vital signs consist of what the mnemonic I came up with, RIP. Respiration, the I I'll tell you in a moment, and P of course is pulse. The I stands for integumentary system, which is the medical term for the skin. And the skin has an awful lot to tell you, and it tells you color, temperature, and how much moisture is coming out. So if somebody is hot and dry, it's something very different from somebody who is hot and moist. So writing all these things down is important. So having something to write on is always good. It doesn't have to be anything in specific. I will send you a sample accident report form where you can keep track of all of these things, and they also will have a list on there of all of these things that you should be keeping track of and checking. So when we check out a person, initially you'll see me do it in the primary assessment, but then once we have a little bit of time with the patient, we'll want to take these vital signs. And depending on whether it's an injury or whether it's an illness, you need to recheck these vital signs every so often. If it's a seriously injured person with broken arm or leg or dislocations, or just really very, very ill, you may need to check these vitals every 5 minutes. If it's somebody who's just kind of sick, has a twisted ankle, and not so sure what's going on, yeah, if you check them every 15 minutes, it's a good idea. But that record will be very important for the EMTs once you hand that person off to them when they go to the hospital to see how that illness or injury developed. Okay, so when we take somebody's pulse, after the initial check, we tend to use the radial pulse. Come on down here. Can you see that? The radial pulse is always located on the thumb side of the patient. That's the radius bone here. And the pulse will be between this bone, and see that tendon there, that tough tendon that makes your hand move back and forth? Right in between there, you should find a pulse. Now go ahead and try that on each other. And we always want to use a finger, never the thumb, because you have your own pulse in your thumb, so you'd be feeling your own pulse. So we want to use 2, sometimes 3 fingers right in that groove. Leave that hand nice and relaxed, and go in there and see if you can find a pulse. You may find that pulse anywhere between right here at the wrist to sometimes all the way up here. Just keep feeling along there in that little groove to see if you can get the pulse. And look, you have a pulse. What are we looking for? Well, we're looking for a pulse somewhere preferably between 60 to 100 on the average normal full-grown person. Now what do you need to tell the pulse? Well, that's where you need a watch with a second hand. And what we want to do is count the pulse, how many times it beats in 30 seconds. So I'm counting here, 1,000. So I'm going to be counting that. And then when I get to 30 seconds, I will know how often that pulse has beat. To write it down though, I need to multiply that times 2, because we want to know what the pulse per minute is, not per second. So pulse per minute. So in this case, it looks like you have a pulse of right about 65. So I'm going to write that down. Pulse 65. The next thing that we want to do is take respiration. And that's the most difficult one, because if you say, could you breathe for me, because I'm going to count your breathing, people don't react naturally. Then they start breathing for you, thinking of what you might be expecting. So the best thing is to somehow take the pulse in a place where you can observe a couple of things at the same time. For example, I can see her breathing by just a shadow moving at her chest, or maybe I can watch her stomach moving, and she doesn't even know what I'm taking. So the best thing is just to say, I'm going to take your vitals, find the pulse, put it someplace where you can observe both things, and then simply count, and you only look at what you need to count So I'll be watching her respiration, and she doesn't even know what I'm doing. And that's the way you get a good respiratory rate. Normal respiration for an adult should be somewhere between 12 and 24. And if it's not, she has a very perfect respiration of 20. And now I want to look at her skin. So sweat is the one thing that has never been known to transmit any diseases. So it's okay to peel your gloves back a little bit and then just check their forehead. If you don't have an actual thermometer, just feel, is it warm, is it cool, or what? Secondly, her temperature is actually normal. Look at the face. Is there sweating, is there perspiration, or is that person very, very dry? And she's very normally dry, okay? And the last thing is coloration. What does the skin look like? Does it look like a normal color? Is it flush? Is it very pale? Is it gray? Or blue, God forbid, because that's very, very bad. And then you write that down, nice and pink in this case. So that gives you a set of vital signs, and again, you need to take that depending on how ill that person is or how badly injured they are. And then you may need to actually tell the people on the other end of the phone if you get in touch with emergency responders, and then they may tell you what else might be possible that you could do. Okay? Those are the vital signs. Thank you.